Welcome to today's topic, how PAD impacts your patients' lives. I'm Susan from Northern Colorado, and in this video, we will cover the impacts of PAD, otherwise known as Peripheral Artery Disease, on patients, as well as their families and caregivers. Many of us take for granted that we can relatively easily move from point A to point B, whether we're traveling up or down stairs, whether we're grocery shopping, getting from the car into a friend's house, or even navigating through a shop or restaurant. For patients with PAD, even these tasks can seem insurmountable. Let's get the perspective of a patient. I'm here with Betty, and she's had PAD for about a year. Betty, can you tell us about the types of symptoms you've experienced?
You bet I can, Susan. The first symptoms I experienced were leg pain. When I was walking around places like the grocery store, my leg would start to hurt and even tingle. At first, I thought it was good because I was overtired and had somehow pulled a muscle or something, since the pain went away when I stopped walking. But then it kept happening. Then I figured, just because I was getting older and that everyone had this type of pain, I didn't know at first that it was PAD.
So Betty, did the symptoms impact your family in any way?
Well, at first, Susan, the symptoms weren't as frequent, and it didn't really make much of a difference. But as time went on, and I wasn't able to walk very far without any pain, my family definitely was impacted. I had to rely on help to even walk my dog. I couldn't even walk upstairs anywhere without pain, so I relied on my family to get things in and out of the basement when they were needed. We'd have to really consider our plans with friends in case we're stairs at their homes and decide if it was really worth the effort. In commercial buildings, I was always looking for an escalator or elevator if it was available, and oftentimes these were much further away than you expect, and the additional walking would cause me pain also. And I often chose movie theater seats closer to the screen if it meant that I wouldn't have to navigate any stairs. Parking also became more of a challenge. We were always looking for a closest spot for everyday errands and even special events. My family members and friends went out of their way to even drop me off and pick me up at the door of a store, and I'd sit, if it was possible, and wait for them to park and join me. If I was having a particularly bad day, with pain after walking only a short distance, we'd sometimes miss out on planned events such as concerts, festivals, or other events. Even when I did get to go, I was always looking out for the place to sit down, and sometimes tell my family or friends to simply go ahead without me.
Betty, were there any other impacts that you noticed?
I sure did, Susan. I noticed that I was giving up a lot of activities that I liked, like golf and bowling and church and my service club, because of walking that was involved. I really felt left out and kind of angry that I had to make so many changes in my life. I also felt guilty because I know that some of my past choices, like years of smoking, have put me at risk for conditions like PAD.
Betty, what advice would you give to someone who thinks they might have PAD symptoms?
Susan, first I'd tell them to talk to their doctor or nurse like I did. When I was diagnosed with PAD, we decided on what to do together. For me, it worked to start with lifestyle changes to help get my underlying conditions under control. We'll look at other treatment options if this isn't enough. Also, it has been helpful to talk with people about my experience. Although it was tough at first because I was really embarrassed by my limitations. My clinic has a support group for patients, and I also talked with some friends at my service club about feeling left out of things. Everyone was very understanding and provided some great perspectives, and they made me feel better when I was having a bad day.
Well, Betty, thank you so much for sharing your experience with us. Understanding the impacts of PAD on patients, families, and caregivers helps all of us to provide the best possible care and continue to work towards the best patient outcomes. For other topics in this series, additional information and resources, please visit pcna.net/PAD. Thank you for joining us.